Are you a caregiver struggling with all of the medical abbreviations or the legal abbreviations or just the abbreviations and acronyms involved in caregiving? Today the one I want to talk about is LTC, which is long-term care. Long-term care can mean a lot of different things. It can mean long-term care in a nursing home. It can mean a long-term care insurance policy. It can mean a long-term care Medicaid waiver. So it's no wonder why all of these acronyms are so confusing. I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker with 25 years of experience helping aging adults and their caregivers work through the medical, legal, financial, and family dynamic aspects of caregiving. You can learn more about me on my website, PamelaDWilson.com, where there is so much help and assistance. Please do like this video, follow my channel, share these videos with other people you know who are looking for hope, help, and support. So let's talk about long-term care. Long-term care, used in the context of long-term care, means that someone is going to need care for a long time, okay? It doesn't relate to the years of caregiving or the time frame of caregiving. It more relates to the abilities of the person to care for themselves on a long-term basis, specific to bathing, dressing, eating, transferring, which is moving about, going to the bathroom, managing incontinence, things like that, and managing health conditions. So at one point in anyone's life, they can be living at home and something crazy can happen all of a sudden. Maybe they have a heart attack or they break a hip and they have to go into the hospital for surgery. And that hospital says, well, you know, you would benefit from some rehab. So the person gets sent to a nursing home for rehab. Now, the idea of that rehab is to get that person back home living independently, right? But sometimes that just doesn't happen. If there are so many health complications, or if a person really can't rehab, if they can't regain their ability to walk because of a hip fracture or something else, then somebody may not be able to go live back at home, which means they may stay in the nursing home for long-term care. Now, the problem with that is not everybody has money to pay for that. So they may need what is called Medicaid, Medi-Cal. States use different terms for it, but basically it's long-term care supports and services program. Now, sometimes that type of Medicaid can be provided in the home through in-home caregivers who come into the home under a Medicaid waiver. But if a person can't go back home, then it can be provided in a nursing home that accepts Medicaid and that has an available room or an available bed. Because nursing homes usually limit the number of Medicaid patients they can have at any one time. And they do that because the payments from Medicaid mean that for this particular person, you know, they maybe break even on care costs. And so for nursing homes to survive financially, they need people in there on rehab where they're getting paid for by private insurance, and they can have some Medicaid beds. So in this case, LTC relates to a long-term care Medicaid application that a nursing home can help you do, or you can go online and find an application or contact your local county Department of Social Services to do that application. Now the thing is, sometimes there are wait lists for long-term care beds in a nursing home. Or if the long-term care is going to be provided in the home under a Medicaid waiver, under home and community-based services or something else, there can be wait lists to get into those programs, and there can also be limitations. So it's important, if you have a parent or you are a person who has a lot of health problems and you're struggling to take care of yourself at home and you think that you may need to go to a community because of a health issue or just there's no one available to help you, look into LTC, long-term care Medicaid, long before you need it. So then let's relate LTC to long-term care insurance. Long-term care insurance is a voluntary insurance that anybody can purchase. And currently, as of this date, the state of Washington has a long-term care program by the state where they are withdrawing funds from people's paychecks. So similar to Medicare and Social Security. Other states are looking at this. New York and California among the next states. And the reason that they're looking at this is because, as in the first example, people who go on Medicaid long-term care, they can live a long time. So the expenditures from the state and the federal money could go on for years and years and years. And so states run out of money. Medicaid programs have to stop accepting people, or they have to delay people coming into the program. And so because of this, states are saying, we need a plan. We need a better plan than this. And so again, the state of Washington is taking payroll deductions to allow residents of Washington, when they become older, to have a little pool of money to pay for long-term care services. Okay? And the last one that we talked about is this long-term care supports and services Medicaid waiver. It's different by every single state. All states will provide some version that provides home and community-based services, a Medicaid caregiver going into a private home, but the person has to qualify financially and by health. And then the long-term care component of living in a community, and that also has qualifications. So again, if you're even thinking that a loved one is going to need long-term care, or you just want to investigate it because you want to be well informed, contact your county Department of Social Services, ask them where you can get information about the state Medicaid program, learn about it long before you or an aging parent or someone else is going to need the program, because as I mentioned, sometimes there are wait lists, and sometimes there can be qualifying factors, disqualifying factors. It can be very complicated, or it can be very easy to qualify depending on one's individual situation. I'm Pamela D. Wilson. I'm a caregiving expert, advocate, and speaker. Again, go to my website, PamelaDWilson.com. Lots of helpful tips there. Please do like this video, follow my channel, share this video so that other people can find their way here. Have a fabulous day. I look forward to seeing you all again soon in another video.